You are listening to Scott H. Silverman's Happy Hour, a podcast released on the first 3 Wednesdays of the month. Family crisis, relationship crisis, addiction crisis, no two crisis situations are the same. They vary by family, individual, and relationship. They can encompass complex family dynamics, emotional distress, anger issues, and entitlements, and often involve substance abuse. This podcast addresses these issues and others surrounding the addiction epidemic currently plaguing this country and the world. There is hope and help.
Are you stuck, scared, or unsure of what to do next? If a situation with a loved one, spouse, or even a child has started to spiral, possibly becoming dangerous or threatening, it's time to seek help. My name is Scott H. Silverman. I help families navigate crisis situations. I'm the person you turn to in order to get you and your loved ones unstuck.
Welcome back to the show. This is Michael Glenn Moore. You're listening to Scott H. Silverman's Happy Hour. I'm Scott's co-host. Scott, what do you got going on today? I know you've got a book coming out pretty soon.
I do.
Do you want to talk about
Michael.
that, or do you have something else? I think Safe Home Coalition has the birthday as well.
It does?
I could have sworn you mentioned that earlier, but maybe I was wrong.
Well, it could be an anniversary. Yeah, anniversary year coming up. I want to say 7 years, I think, for the Safe Home Coalition, but we're going to talk more about that. But obviously the slide behind me is my book, The Opioid Epidemic, and it's going to be coming out in the next couple of weeks in the month of May. I'm real excited about it. Ebook will be available and pre-selling on Amazon right now. So that's my public service announcement for that. So anyway, welcome to Happy Hour. I'm Scott H. Silverman. Again, I give out my phone number. It's 619-993-2738, 619-993-2738. And I give it out because I want people to text or call me. You know, we're all seeing the overdoses now. We're all seeing individuals that are in crisis, especially with COVID. So if you're not sure what to do, call me. We'll help you get navigating in the right direction. So I'm your crisis coach and your family navigator. And today I'm your co-host with Michael, and we have a couple of awesome guests. So we're going to start with the youngest first, Kenan Thomas, 16 years old. Are you going to be 17 soon?
Yes, in June.
Thank God, because it feels like I've been calling you 16 for so long. She and I have been working together for over a year. We see each other with masks on, so I've never seen her face. And as you all can see, she is much better looking than I am. So Ms. Thomas, 16 years old, was born, raised in San Diego, California, currently a junior at La Jolla High School. That's where my girls went. Kenan has been an active Girl Scout for 10 years and currently working on her Girl Scout Gold Award. And she's in uniform today. She plays both indoor and beach volleyball and loves all things related to the ocean. So we're going to get to her questions in just a minute. So with that, Madeleine Baudoin Ghorashi, is that correct?
Ghorashi, yeah.
Ghorashi. Madeleine Baudoin Ghorashi is a government relations, public affairs, and advocacy professional with an extensive experience working for top companies in emergency medical services. Boy, I could have used you back in my day. Behavioral health, the life science industry. Over the course of her career, she has developed a deep understanding of government relations, advocacy, and the various roles she has served as the advocate and vice president for Behavioral Health Association, NAMI, and mental health systems, a policy advisor to Representative Scott Peters. I'm going to see him very soon. He's going to be doing our show. When he was a council member in her role as associate director of federal affairs at Biocom. In her current position as a government and public affairs manager for American Medical Response, that's the biggest, largest ambulance company here in San Diego, the largest emergency medical transportation company actually in the world. Beyond her experience in government affairs and advocacy, Madeleine also mindfulness consultant. She teaches mindfulness-based stress reduction. I need a couple sessions, please, for the public through her firm, Mindfulness. I like that. In her spare time, Madeleine enjoys hiking, tennis, yoga, spending time with family and friends. She's a graduate of Emerson College, holds a Bachelor of Science focused on management, communications, public relations from Emerson College. She also studied mindfulness at the Center of Mindfulness, UCSD School of Medicine, is qualified teacher of mindfulness-based reduction and a program created by John Kabat-Zinn. Is that correct? All right. All right, we're going to jump right into it. So real quick before I go into the questions, Madeleine and I have worked together for a couple of years. And today our topic is about removing unsafe and unused medication from the home, specifically opioids, because that's one of the biggest that sits in medicine cabinets right now across our country, one of the biggest anyway. And Madeleine represents, as I said, AMR, and they were very, very big supporters of Safe Homes Coalition, which is a 501c3 nonprofit here in San Diego that coincidentally I happen to run and be part of and have for many, many years. And they came in and not only brought their time and talent and treasury, but Madeleine, we tried to get her as a loan executive every week, but we couldn't get her because she's so involved with all different aspects of supporting the community. But AMR actually took the bags that we have at Safe Home Coalition. We have two different types of bags. One is one that you actually give to a family. They mail the substances they have in their medicine cabinet, and it goes to a firm in Texas and it gets incinerated and it gets weighed and counted, and we get credit for it here in our community. We also have another bag that they can give to families, which they've put on their ambulances when they have a situation where they've gone in the home, unfortunately for overdoses and other issues, and they've given that bag to families. So they're a real ambassador, not only of ours, but also of the community. So the Safe Homes Coalition, and if you want to look it up, it's makeitaSafeHome.org. That's our website. We're based in San Diego. And Kenan was actually referred to me, I think, through the Prescription Drug Abuse Task Force, if I'm not mistaken, and wanted to get involved. And we started talking, and she said, I'd like to help. And I said, why? And she's going to tell us a little bit about that today. But she's been very, very supportive over the last year with myself, and actually connected with AMR. And AMR gave us a recent grant, so we can now support Kenan and her Girl Scouts here in this part of the region to help educate doctors and teachers. And we've got a cool little senior thing coming up later this year, but we'll see how that goes. So it's really kind of cool that we're all here today to find a way to not only educate people, but get them motivated to get rid of. And today, actually the 24th of April is the National Take Back Day. It's put on by the DEA, Division of the Department of Justice. So across the country right now, people are putting their medication in bags and taking them to specified drop-off points. And that's one of the biggest things that the DEA does, in my opinion, that's really proactive. It's not a criminal side of what they do. It's more of a help the community side, which is really kind of nice. Unfortunately, they only do it twice a year. So Madeleine and I and Kenan, we work year round to help educate families. And we're going to get into the questions right now. So Kenan, I'm going to start with you. Tell us about your experience as a Girl Scout.
Sure. So I've been in Girl Scout for 10 years, ever since I was in second grade, and I'm currently at the ambassador level, which is what it's called when you're a junior and senior in high school. And I'm a member of Troop 3890. And my time in Girl Scouts has been super fun. I've sold cookies almost every year, excluding this year with COVID. I've done lots of volunteer work in kitchens. And recently, this past spring, we've collected over 400 pounds of food for the food bank, because they were really struggling during COVID. And also, I earned my Girl Scout Silver Award when I was in 8th grade. And that was the precursor to this Gold Award. And it was about home disaster kits, because it was at a time when there were so many fires in California. I mean, granted, there's fires often, but it was really about getting people to be prepared for natural disasters.
Awesome. So what is a Girl Scout Gold Award, actually? What is it?
A Girl Scout Gold Award is the highest level award that a Girl Scout can earn, and it's equivalent to the Boy Scout Eagle Scout Award, which is more commonly known. And there's lots of requirements to get the award, but the main thing is that the project has to be a take action project where you address an issue and actually take action on it. And it has to be sustainable, and it can be continued to be carrying, and it has to be carried out continuously.
Awesome. So what made you want to get involved with the Safe Drug Disposal and Safe Homes Coalition? Actually, what even made you want to call me, other than the fact that someone gave you my number? Because I don't know if I've actually ever asked you that. She giggles politely. Thank you.
Yeah,
so what made you want to get involved?
I don't know if we've ever actually talked about this. So one of the main things is recently I got my wisdom teeth removed, and I was told that it was going to be like so much pain. My friends and family were out for like over a week lying in bed. So I decided to be prescribed opioids, and I was prescribed them, and I only ended up using a few. And after I had this whole bottle of pills, I had no idea what to do with it. And I realized that in my age group, no one really knows what to do with their medication, and no one really in general knows what to do with it. And people my age often, not me, of course, if they have these extra pills lying around, they'll take them, they'll abuse them, they'll sell them to their friends for money, and then they go to a wrong place with the drugs. So that's why I really wanted to get involved, because I thought that I needed to be addressed for my age group, and just seeing friends in my family going through rehab and overdosing is a really sad thing. And I think that just needed to be addressed.
Having someone, even talk about that publicly, one of the things that I spend a lot of time on, and Michael and I talk a lot about, is reducing the stigma. So to be able to sit here and someone in your generation be able to speak about it in such a proactive way, it's really great. So what things have you learned, or what has surprised you while working on this project?
What surprised me is how much I now notice it in the media. Like all of a sudden I'm reading the newspaper and I'll see, oh my gosh, overdoses are up. I'll watch the news and I'll see you on the news talking about it. And I just hear it so much now. So that's one thing that has surprised me. And also just how much people don't know about getting rid of medicine, even in the healthcare field, like reaching out to doctors. They're like, oh, I never really thought about what my patients do if they don't use the drugs. Like, oh, they probably just keep it in their medicine cabinets. So just making people aware is what I wanted to do with this.
Wow. So tell me, what would you like the audience to take away from your part of our conversation today? What should people, when they see this and listen to it, when they end it and they sit around with their family, spend the next couple hours debriefing, which I'm sure everyone will do, what would you want them to take away?
I think I'd want people to take away that it's easier to get rid of your drugs than you think. Take them to pharmacies, use our mailback envelopes, get rid of them. There's so many more options than the TEA take back days, which are twice a year. Like the default should not be that they sit in your medicine cabinet. You should get rid of them.
Right. And people, they've thought about it over the years. Well, I'll just flush it down the toilet. Well, that just goes down the water system, which goes into, killing mammals and other animals. And then, of course, if you put them in the landfill, people think, well, that's just trash. Well, a lot of birds fly around there. They pick the things up. And then, of course, that process in its own right can kill animals. So the idea of being able to have a safe disposal and getting rid of unused and unsafe. So a couple quick statistics, then we're going to go to you, Madeleine. In 2016, 264 million prescriptions of OxyContin were dispensed in our country. 264 million prescriptions, not pills, prescriptions. Average prescription was 60 to 90 days back in those days, just 5 years ago, until people really started to become aware of it. And according to the CDC, which just launched this information about 2 months ago, 61% of those prescriptions still sit in medicine cabinets. 61%. You do the math. That's a lot of pills sitting out there that are unsafe, unused. Young people are getting exposed to. They go to grandma's house, they go to auntie's house, or in your case, and as you said, your friends, they use them for a day or two or three, and they don't like it, and they keep going when, they just stop. What do they do with those pills? And you're absolutely right. Doctors, they don't really know yet how to give that information to their patient when they're prescribing it. Pharmacies are starting to do it now, and it's important that we think about it. And another piece of information that's real critical is 2 weeks ago, the CDC just said that 90,238 overdose deaths from opioids through September of last year is the new count, which is up 28% from the year before. And keep in mind, obviously, with COVID and people being at home, we're seeing increases everywhere. San Diego County has a 400% increase in overdoses. So this topic is so critical, so topical, and so important that the fact that we're able to even talk about it and share the information is really, really critical. So when you think about that, through September of last year, most times the hardest part of the year is holidays for people. So when the new data comes out, they're expecting it to be north of 100,000 in one calendar year. That's a little over 240 a day, which is a plane crash. Literally, think about that. 240 people dying in our country, just America, every single day behind opioids. We're not talking other drugs. We're not talking alcohol. We're not talking suicide. We're talking just opioids. So Madeleine, all that exciting news, over to you. So tell us about American Medical Response, AMR, and the great company that you work for. And as one of our biggest supporters at Safe Homes Coalition, I can't tell you how excited we are to have you here today. So tell us all about AMR, and you. Tell us about you.
We're so excited. I'm so excited to be here. Thank you. So American Medical Response is a leading medical transportation company in America, and we employ 38,000 employees across the nation. Here locally in San Diego, we employ 1,200 employees who respond to 200,000, actually over 200,000 911 EMS emergency medical services transports a year. So that's a lot of transports per year, doing great work. And we're just so happy to have partnered with Safe Homes Coalition. Today is happy Drug Take Back Day to everybody. Today is Drug Take Back Day, and what a timely conversation to have today. I know we're doing a lot of social media today around Take Back Day here locally in San Diego.
We are. And well, coincidental day, I think it was you who said, hey, how about the 24th? It's the Take Back Day. What a great suggestion. And everybody was available. So that, and the timing is great. People won't see this for a couple of weeks, but we, as a small little grassroots organization here in San Diego, in partnership with groups like yourself and supporters like Kenan, we're doing this year round. I mean, we don't have the capacity to really build on it yet, but we think we're going to draw some attention. And especially, I'm hopeful when the book comes out, how do we help save families' lives? And obviously, your company does that. Before we go deeper, though, in your role, tell us a little about you and Madeleine and the work that you've done in the community. And maybe if you want to sneak a little personal stuff in there about your family, we'd love to get to know you a little bit.
Oh, absolutely. So I've been with American Medical Response for about 9 years. My role at AMR, I run the Government and Public Affairs department. And so I get to represent AMR in the community, and a lot of what we do is the injury and illness prevention. And that's where Safe Homes Coalition came along in our partnership with Safe Homes Coalition, whose mission is to reduce overdose deaths. This week personally, I had, a very difficult couple weeks. I lost my mother-in-law last week. So it's been a difficult time for my family. I'm actually in Orange County right now at my father-in-law's place. And so we're working with the family right now, but I was just really excited to be invited onto, Scott, your show here. So I carved out some time, and this is just such an important topic. We do see, our paramedics see overdoses nearly every single day. It really is a personal, it's personal to a lot of, our paramedics, EMTs, and the Safe Homes Coalition is something that I think, the AMR family as a whole has gotten behind. And I was so excited about Kenan's project because I just thought that was such an interesting, component to, added, importance to safeguarding medications and having that conversation with the doctor and having the doctor have those conversations with young adults as well as families. So we're really excited, Kenan, to be supporting your project.
So Kenan, what do you think about that when you hear that?
Kenan, I'm so sorry, Kenan.
It's fine.
It took me a year. Don't worry about it. It's I still I'm going to petition your family. as you look at it, we read it right. So Kenan, what do you think about that when you hear that from Madeleine? Because that's kind of cool. Big corporation, 38,000 employees, largest in the world, talking to a kid at La Jolla High School about the great work that you're doing. I mean, that's kind of cool. What are your thoughts?
Well, I'm just so thankful for AMR's support of my project. And it's so cool seeing such a large corporation taking the time to support this smaller project. And it really just means so much to me. And it feels like my actions aren't going unnoticed and that they're truly making a difference.
Awesome.
Great.
So Madeleine, back to you. So tell us more about your role at AMR. By the way, people ask me all the time, why would you connect with an ambulance? My attitude is, we joked when we first started talking about this, and you've been involved with this project longer than I've been involved with Safe Home Coalition. You were back in the very beginning. Mm-hmm. Is when you think about it, when somebody, calls 911 and needs to be transported, it's the ambulance company. So for me, it was just organic connectivity. And when you and I talked about it, you said, yes, I'm glad you're back. And how can we help? And it's just been just a great relationship. So tell us more about your role in it. By the way, I'm so sorry about your loss. What a sad thing to have happen. So,
Thank
thoughts
you.
and prayers for you and your family.
Thank you,
So,
Scott.
so tell us about your role at AMR.
Sure.
What do you do?
Sure.
So big.
Well, I run the Government and Public Affairs Department for AMR, and I oversee our corporate social responsibility programs, and also put into place corporate social responsibility programs, injury and illness prevention campaigns, and we look at data. We look at data and target our our community giving around injury and illness prevention that we're seeing within the community, right? So in 2017, and Scott, I think you had just mentioned all of the data from 2016, the opioid crisis across the nation, and it was a problem in San Diego County, and our paramedics again were first on scene, and we were seeing this. And in 2017, we set a goal to reduce accidental overdose deaths, and we partnered with the Safe Homes Coalition. And then, with Scott, with your leadership, the group expanded really, and we kicked off the Safe Kids program, and the neighborhood walks, and going into the communities, knocking on doors, educating families that way on, the importance of safeguarding the medications, as well as these awesome bags, these prepaid mail order bags to make it easy for the community to safely dispose of their medications. Because we all get lazy too. I mean, you get a prescription, and getting into your car or gathering all of the meds and getting into your car and actually dropping it off. I mean, that takes some time. So this kind of cuts out that time, and it really is a real easy, safe way to dispose of your medication. And then also just the education component as well is extremely important. So we did the neighborhood walks, and then we also we've got the prepaid envelopes also on our ambulances. So, and we still do to this day. So when our paramedics, respond to a call, or sometimes, when we are responding to calls, other than, overdoses, family members will talk to our paramedics and EMTs, and we get to know people as well. So we hand out the bags as needed. So if we see a need, our paramedics and the EMTs see a need, then we give the bags to the families so that they can easily dispose of their medications.
Yeah. One of the pivoting points that started all of this was people were going into, that's how we partnered last year, actually the year before now, it's almost 2 years, with the San Diego Association of Realtors, is people were actually going into open houses. And can you imagine that, Kenan? You and I go in, you could probably go in as my granddaughter, and we'd go in and you'd say, hey, yeah, we're trying to get my grandpa a new home because we want him out of our house. And I'd say, why don't you just go out to the backyard with a realtor and I'll take a look at the living room. You'd go outside with the realtor. I go rifling through the medicine cabinets, not the safe, not the jewelry, not the cash, but the medicine cabinet. And that's kind of the things that really got this kicked off. And then the program was replicated in Boston, a couple of years later, because this is easy to do. And the mailback bags, when you think about it, I don't know anyone else is doing it. There are companies who make a bag where you put your own stuff in and they use a charcoal filter, but that doesn't necessarily give 100% dissolving of it. And I believe the DEA has said there's only 5 companies in the entire country that actually are approved by them to dispose of this kind of level, Schedule 4 and 5 medications, like the Xanaxes and the Valiums, and of course the opioids. And one of the things that we're seeing now, Madeleine, more than ever, is the fentanyl overdoses that are taking place. And that's obviously an illegal opioid where Oxycontin was manufactured, but it's hard to get now because no one's well, it's not no one. Someone they've slowed down the writing of the prescriptions because the medical association has finally said, hey, we need to stop doing it. And pharmacies are making themselves very aware, and they're questioning people when they come in and they check a system. It's called Cures in California, where they can actually see where that person standing in front of them when they've gotten medication before and most recently. So tell us about, the paramedics. What are the paramedics and the EMTs seeing today that might be a little bit different than what it was, say, 2 or 3 years ago with the overdoses that are taking place? Let's just use, well, whatever if you have global information, great. If not, San Diego, because we know it's up 400%. That's according to the task force and to the behavioral health and the county and the public health and also the district attorney and the medical examiner. I mean, that's where the data comes from. The person who sees the body last. That is scary when you think about it.
Sure. Yeah, we're definitely seeing an uptick in overdoses with the pandemic. It's tragic. And I don't have specific data, but the 40% that you had mentioned, I think lines up with what we're seeing. There's definitely an uptick in Narcan administration with our paramedics, right? So we can measure it that way. This year we've been administering more Narcan, which is a life-saving medication that can help reverse the effects of an opioid overdose. So we've been tracking that, and yeah, it's tragic, especially when our paramedics respond to younger teens that may have got any overdose, and any overdose is just it's tragic. So and I talked to so the safeguarding, especially when it comes to teens, and the education that Kenan is doing with the doctors is really an important component to that. Yeah, absolutely.
Right. So Madeleine, so what made you kind of mentioned it, but I want to get a little more specific and nail down here a little bit, press you a bit. What made you want to support Kenan's Gold Award Project? Because it's, when you think about it, I'm sure as a company, you probably get, I know how busy you are, because when I call you on Monday, I usually hear back within a month or so. You're so busy. No, you're very responsive, but I know how involved, government affairs is just, it's such a broad-based thing. And I'm sure your company gets tons of requests. I didn't mean to embarrass you, but it's my friggin' show and I want to do that. So tell me why you wanted to be involved with this, because you immediately said, this is awesome. Get me a paper, a concept paper, proposal. This is something that I think, we would like to support. And you ran it up the flagpole and you came back with a positive answer very quickly. So what was it that motivated you to want to be part of this gold project?
Well, I think it's really it's personal for us, because, our caregivers see this problem every single day, and anything that we can do to help prevent another overdose, that's everything to us. And Kenan's just the whole project of going and educating the docs, and then also I think an added component is also, and I would encourage just the general public to also talk to your doc, ask questions when you're written a prescription. Ask questions. I mean, way back when they used to prescribe 30, 60 pills for getting a tooth pulled, some people were used to taking just think that they need to take the whole thing and run it, have the medication run its course, and then they're hooked on it, right? So it's important to have that conversation with your doctor, and then also just Kenan's educating the doctors about the importance of educating the families that they're prescribing. So that's another added component. So I was really excited about that, because I hadn't seen, I haven't seen anybody working on that aspect of the education and prevention programming in association with that. So I think it's great. And I'd love to see, hear about Kenan, what you're hearing from the doctors, how receptive they have been to you, have they been, what's going on with that?
Yeah, so the first person who I went to was actually the doctor who took my wisdom teeth out. And I approached him around the time before I even got them out and said, hey, would you be interested in this? He was like, oh yeah, sure, totally, like bring them in, bring them in. And so about a few months later, after talking to Mr. Silverman, I brought in a batch of 50 envelopes. And then like a week or two later, I checked up. I was like, oh, how's it going? Are they good? And then I talked to their clinic manager, Stacy, and she's like, oh, it's going great. Please bring 50 more in. People are loving them. So I bring another 50 in. And then just the other day, yesterday, I dropped off another 100 there because they've gotten such a great response. And when he meets with like the kids, normally people get their wisdom teeth out are in their teens or early 20s. Their families are like, wow, this is great. I never even thought about this. Like, this is super convenient, being able to mail back the envelopes. And then I've also brought 250 of the mailback envelopes to Rady's Children's Hospital, and they were distributed to pediatricians to give out. And I also brought 300 of the pharmacy bags to give to Rady's, and they were going to do a big push for DEA Take Back Day, kind of combine their advertising efforts just to get even more awareness for this issue.
That's
Madeleine,
great.
what do you think? Do you see Kenan as a future executive director, assuming that she wants to get involved with a community-based organization? I mean, that's just remarkable. That's just awesome. Okay, go ahead, Madeleine. What's your follow-up? I'm going to step out and let the two of you go ahead and chat for a while because you've got the great questions. So, Madeleine, let me ask you, what question have we not asked you that we should ask you today?
Oh my goodness. I think you've covered pretty much everything. I think you've covered I can't think of anything else. Absolutely. Well, I mean, I would, I'm kind of getting excited about this. I'm gonna talk to my dentist to see, if Kenan if he could use some of the bags, if you have any left over. I think, my dentist could use them for sure.
Well, good. We got you inspired today. That's awesome. So Kenan, how about you? What question have we not asked you that, really what this means is there something you'd like to share that we haven't asked you that you think would be important for people? Because I'm hoping that today, what we're doing today will really pivot us and take us to a whole new level with, and the fact that, most overdoses of opioids are happening with young people in their 20s. It is a young person's issue, especially because fentanyl is so powerful and there aren't many accidental overdoses with fentanyl where people survive unless they're walking around with, naloxone in the Narcan, portal. And not many, I carry it in my car because I'm passionate about it. And when it comes to that, it's one of the few medications that will reverse an overdose. So, and all of the EMTs and paramedics and law enforcement now in our community. But I was just talking to a group just last week who just introduced Narcan to a sober living home in New Jersey, and we've been doing it here in our community. I know the sheriff's department's been on board with it for almost 7 years. So San Diego is pretty progressive when you think about it. So Kenan, back to you. What question haven't we asked that we should? Then we're going to go to Michael to see what we've missed because he's the brains in the outfit.
Well, not exactly question, but I would just say that in my age group, I think that people really underestimate how dangerous prescription opioids and all prescription medication can be. I think that teenagers and young adults see it as a more safe option to illicit substances because it's coming from a doctor. Oh, a doctor has it. Oh, my mom took 2 of these pills last night and she's fine. But then once people start distributing these medicine to their friends, it just goes crazy. And doing this project, I learned that 9 out of 10 addictions start in teen years. I think that statistic really made me realize, wow, like this is such a crazy problem.
Awesome.
Absolutely.
Michael, go ahead, Madeleine. Did you want to follow up?
Sure. Yeah. I mean, Kenan, I think hit the nail on the head. I mean, I think also sometimes people, just to go a little bit further into it, sometimes people offer their friends or family members a pill because they're trying to help. So if you have a family member that has pain or, something's going on where somebody is feeling a little anxious, and they give their pills to their loved ones or their friends. And that's a really dangerous thing to do. If you're in pain or you're feeling anxious, please talk to your doctor. Do not go to your friends or family members for prescription drugs. And then also just the safeguarding of addictive medications. Make sure that they're in a safe place. Make sure that they don't get into the wrong hands. And
I'm a retired unlicensed pharmacist, and people used to come to me for things. So I absolutely agree with you. And, when you have a situation, just be informed. Just get information and understand and ask questions. And if you're not sure how to do that, talk to someone you care about and you trust. So Michael, over to you. What questions have we missed today? What's on your mind?
Well, I wanted to ask Kenan a question about where she might be going after Girl Scouts. The ultimate badge would be the gold badge. What happens next? Will you be a troop leader, or will you kind of just go to college and focus on other things?
So after I earn my gold award, I'll be a senior next year in high school, and that's kind of where Girl Scout ends. And then there's no Girl Scouts when you're out of high school. So then once I go to college, if I have kids in the future, then I'll probably encourage my kids to get involved in Girl Scouts and potentially be a troop leader.
That's awesome. Okay. Madeleine, I was going to ask you a question about street drugs versus prescribed drugs as far as opioids. Is there a statistic saying what is most prevalent with people overdosing? I know that a lot of street drugs are laced with fentanyl, and I'm not sure how Narcan works on that, if you can reverse fentanyl overdoses, but what do you know any statistics on that?
I don't have any statistics on that, but the street drugs are definitely usually very addictive drugs, and once we see people on street drugs, they're addicted. But I don't have any readily available statistics on that. Narcan can help reverse the effects of any opioid, including a street drug opioid. Yeah.
Well, thank goodness for Narcan. I know it's made a big difference since they found out about it. And it's relatively new, isn't it? It's only been about 10, 15 years or so.
Yeah. Yeah. It's relatively new. We've had them on our ambulances, we've had it on our ambulances for some time. I think it was 2 years ago. The sheriff's department now is carrying Narcan as well. I believe that it can also be prescribed in the county of San Diego County, I believe, Scott.
They're working on getting it. And by the way, the medication that's in Narcan, it's called naloxone, and naloxone used to be given in the form of an injection, and then Narcan was created because it's a delivery system that's like a nasal spray, so it made it easy. And it's one of those things that if you gave it to somebody, and sometimes they have to give multiple doses to someone who may have taken like a heroin that's cut with fentanyl, but you have to have it present. It's got to be given. And so far, there's been no side effects. So if you're not sure it's an overdose, you can give it to somebody. And the other question I think you had, Michael, about what percentage potentially are street drugs versus prescription. Prescription drugs have a quality assurance to them, which is different. Street drugs, there is no quality assurance. So, it's sometimes hard to really read if somebody has Oxycontin and fentanyl in their system, exactly what it was, because sometimes it'll just stop the heart, prevent you from breathing. Other things can take place. So that's a great question, though, and I'll get an answer for us about what percentage are street drugs versus prescription medication. But an interesting fact is of the 100% heroin users, heroin usually through smoking or injection, came from kicking off first with pain medication. So there was something that triggered the heroin, because generally what happens is you can no longer get the prescription. There's a sunset on it. Even bad doctors at some point stopped writing prescriptions. But if you talk to the heroin addicts that have been arrested, that's where they get that information, that 75% or more of them started on some form of prescription medication. And to add to that fact, the average person, if they take Oxycontin more than 2 weeks, have a high probability of becoming addicted to it. Now, if you're predisposed, like I am, as somebody who is an addict, who has that part of their brain that's kind of wired funny, it's immediate. So, for example, when I went in for surgery years ago for something, I was very careful, and morphine IV drip is what they gave me, and they sent me home with morphine. And, I didn't take it. It was not fun, but I didn't want it to trigger my addiction. So, but anybody who takes Oxycontin 2 weeks in a row, to Kenan's point, a doctor, dentist gives the information to a client or a patient, and they take it home and they go, wow, the doctor says it's 30 days. I should take it for 30 days. There's such a high probability that a young person can become addicted to it that quickly. So that's information that a lot of people just don't have.
Okay, why don't we get to our quotes? Kenan, why don't you start us off with your quote, and then we'll go to Madeleine.
Sure. So my quote today is from a portion of the Girl Scouts mission statement, which is to make the world a better place. And I just chose this because I think that it applies well to our work that we've all been doing together, and that everyone has the ability to contribute to making the world a better place, and that no act is too small.
Cool. Okay, Madeleine, how about you?
Sure. So I'm going to read my favorite poem, Walking Slowly by Dana Folds. It only takes a reminder to breathe, a moment to be still, and just like that, something in me settles, softens, makes space for imperfection. The harsh voice of judgment drops to a whisper, and I remember again that life isn't a relay race, that we will all cross the finish line, that waking up to life is what we were born for. As many times as I forget, catch myself charging forward without even knowing where I'm going. To stop, to breathe, and be, and walk slowly into the mystery.